Okay, welcome to today's conversation where we'll be diving into all things pleasure, pelvic health, and empowerment with two extraordinary guests. First, we have Heather Florio, CEO of Desert Harvest, a leader in pelvic health innovation. Heather collaborates with medical professionals worldwide, spearheading research and developing top-tier pelvic health products. She's passionate about education and advocacy, working to create lasting change in women's pelvic and sexual health across the globe. Joining us as well is Dee Hartmann, an internationally recognized author, teacher, and speaker specializing in the treatment of chronic vulvar pain. With over 27 years of private practice, Dee has dedicated her career to helping women overcome chronic pelvic pain, sexual dysfunction, and bladder and bowel disorders. Her expertise has made her a sought-after voice in the field of women's health. So I'm so happy to have you. This is going to be a really special conversation. I'm so excited. Thank you both for being here.
Thanks for having us.
Yeah, thank you.
Absolutely. So let's start off with just talking about vulvar anatomy.
Perfect. Perfect, perfect. Um, I've spent my life, as you said, in the world of chronic vulvar pain, dealing with women who are unable to have intercourse or even touch themselves because of pain. And I'm here to tell you that none of it should ever hurt. Okay, it's very common that it does, unfortunately, but normal is no pain. You should be able to touch yourself. You should be able to have intercourse. You should be able to use a tampon, wear tight jeans, sit on a horse, on a bicycle. That's abnormal. Too many women these days think, well, I've always had pain, so that must just be the way it is. So that's the caveat that I would like to begin with. That's where I've spent my life. Where I've really gone to further from that and further from my practice is really to look more into the anatomy and how pleasure happens. Because if we don't really know how to make it happen, and we only depend on our partner to give us that pleasure, that sexual pleasure, then I think we're missing the boat. Because if you change partners or if something happens or you're not happy with them that day, they can't give you an orgasm. That's really not fair because an orgasm really belongs to you. So, to start with that, and because I'm a physical therapist, I always like to start with anatomy. And if any of you read my blog, you saw some anatomy there. You saw that this was on the blog. This is a pelvis. This is the front. This is the bottom. This is the back where the spine comes down. What we're talking about are the pelvic floor muscles, two layers of pelvic floor muscles that sit just right at the level of the bone and up and in. Superficial pelvic floor muscles are really small and don't do a lot of contracting. The deep pelvic floor muscles, on the other hand, are quite broad and very contractile. They pull up and in and let go, up and in and let go. So if we put this back on, we see that this little nub on my wonderful model, just above the urethral opening and the vaginal opening, is what we refer to as the clitoral glands. And everybody thinks that that's the whole part of the whole. However, I'm here to suggest to you that if we look at this, we see a whole lot more. This is that represents the vaginal opening here. This is the opening of the urethra, urethral orifice. And above that sits the whole of the clitoral body. Fortunately, they come apart, so I can hold it this way. The clitoris is similar to the male sex organ, but it's not just a little penis. Trust me, it does a whole lot more than that. The pink area is from one embryologic origin. It comes from one part of the brain during development in utero, and with arousal, it actually gets a little firm. We Clitorises don't become erect. We know that from the research, but this becomes a little bit firm. But what you see, if you can see, it's a little hard to see, and I don't have on black, so it's a little hard to put over here by my crib. This yellow part is that clitoral glands, just a very small fraction of the whole structure. And from that, you see the purple coming down from that into these vestibular bulbs. Again, from a different embryologic origin, a different part of the body stem, these are actually filled with corpuscles that feel good when they're touched and filled with blood vessels. So with arousal, they too will get bigger as they get more filled with blood. When they're not filled with blood, they're actually quite small. This is another model. This is an unaroused clitoris. And boy, getting in focus is hard here. This is an unaroused, well, here, an unaroused clitoris compared to an aroused clitoris.
Hmm.
Now, if you think about that, what happens when these guys get bigger and filled with blood and they sit around the opening of the vaginal canal? As they get bigger, and this is basically an aroused clitoris, as they get bigger, they put a little bit of pressure into the lateral vaginal walls. So interestingly, with full arousal, which sometimes can take 30 to 45 minutes, let's be clear, we're not like boys. We aren't used to touching our penis 14 times a day to go to the bathroom. We don't know. We have to learn all of this. All of these areas are sensitive to touch when we're aroused and can create pleasure. We don't need to just stay right here. I heard any number of women say, I can almost have an orgasm. I get really close, and then I can't go all the way. Because over 10,000 little nerve endings live right here. You can oversensitize that, and it becomes very, doesn't want to be touched. Get away from me. However, all of this area, everything that you see is sensitive to the touch. You can come up on the side and into here for pleasurable touch. You can come just inside your vagina and take your thumb on the outside and the outer edge, or bring your fingers, between your labia majora, the big lips, and this vestibular bulb, and that's pleasurable. But until we know how to reach that full level of arousal, we can't get there. So, what we know now, you see that this is the opening of the vaginal canal. What comes up from that is the vagina. Okay, this is not the vagina. This is the vulva. This is the outside. Okay, vaginal canal is quite important. It's the birth canal. It comes up and in and attaches in to the base of the cervix, or the lowest part of the uterus. It does have some contractile tissues, but it's very expandable. Think of a baby's head coming through that. It's very expandable. And it's also very important. And from that, I kick the ball to Heather to talk to you a little bit about the vagina.
Yes, so vaginal care is very important to not only self-care, but to being able to access and maximize your pleasure, and not experience pain and discomfort as part of your overall pleasure or experience. And one of those things is what you put inside your vagina, outside of even when you think of penile stimulation. Is his penis clean? Are we putting things that are necessarily clean in our vaginal biome? You think about bacterial growth, other things that might be happening when a phallus penis is sitting in a man's pants all day long, and the type of growth that can happen. So it's very important first that the tools that you're utilizing, them being self-care tools, whether they're vibrators, dildos, whether you're actually talking about a phallus or a penis, you want to make sure that you clean those. And each one might be a different way to clean, such as silicone lubricants can actually break down silicone, medical grade silicone dildos and other sex toys. And so you want to be thinking about how you clean those. We at Desert Harvest utilize what's called Aloe Fresh wipes, because those you can clean off anything. They have lactobacillus, which is part of your dominant bacteria in your vaginal biome. And so you can utilize those to clean off. But also, you also want to think about the type of lubricants that you're utilizing as well. So vaginal lubricants and anal lubricants, let's think of those as two completely separate categories. You never put a vaginal lubricant in your anal biome, and vice versa, because the vaginal biome is acidic, the anal biome is alkaline. And so as a result, you want to think about what you're putting as an acidic lubricant in your vaginal biome. But also, you also want to think about osmolality. And osmolality is how the fluid flows in and out of your epithelial cell, your vaginal wall. And that is your protective barrier against STIs, bacteria, fungus. This is your protective barrier. And if you're not taking care of it and you're utilizing a lubricant that is not isoosmolar, which means you're either using a hyper or hypoosmolar lubricant, you're damaging that epithelial cell layer, and eventually it dries out. And over time, it literally can fall out, which means you have just lost your protective barrier as well. And so you have to think about, and I will tell you, many of the lubricants that are out there on the market, your standard go-tos, I won't name names, but the ones you can standardly find in the stores, their osmolality, there was a study done by the World Health Organization in 2016 for third country sex workers, and they were looking at how to prevent STI rates from it increasing, and they looked specifically at lubricants. And when they did, almost everyone that they pulled off the shelf, except for one, was isoosmolar. And so as a result, you're thinking the ideal vaginal osmolality is 290, and you only want to be plus or minus 80 points from that number to be isoosmolar. And so you've got to think most of the lubricants on the market, 10,000, 9,000, 2,000, and even some all the way down here at like 80 or less on the hypo side of things. So you're completely throwing off your biome. And it is required that a sexual lubricant in the United States be a medical device. So as a result, every lubricant on the market has done that testing. And if they haven't, then they are not an FDA cleared medical devices required by law. And that is not something you should be putting in your biome. And you can ask every lubricant company for their osmolality number because they have it, whether they put it out there or not. And so it's very important to just think about those things as you engage in sex because this is a part of your overall self-care.
Mhm. That's good to know.
Yeah.
Let's sort of talk about, we're labeling all the parts, and we talked a little bit about the vaginal canal and the vulva. So I think a lot of people think we call, the vagina is not the vagina, it's the vulva. So I'm just wondering, is there a way that we can sort of change the narrative around renaming our parts?
Well, it's not going to happen from an anatomical perspective, unfortunately. We can't even get current medical research into the medical practice, much less anything else. Um, but we know that everyone is very, very cautious about talking about either the vulva or the vagina. Don't say those words. Those are naughty words. Those are bad. We have a whole wall of plaques now of female genitalia that for years was the wall of vaginas.
Hmm.
Okay, let's be clear. It's now they've changed it. It's now the wall of vulvas. But so we're just babies. We're just babies in
Mhm.
this, and it's going to take a long, trust me, all of my granddaughters who are between the ages of 5 and 7, and there are four of them, all know their vulvas.
Mhm.
That's what's going to change it. We just have to get that into these young kids who are talking about it. And when my son told his daughter not to forget to clean her vagina, she said, "Dad, it's a vulva, not a vagina." That's how it's going to change. I don't think we're going to get people in
Mhm.
general to change their ways because that's just well, getting them to talk about it is one thing. We talk about the male penis and all the time,
Mhm.
but we don't
Mhm.
talk about the women's parts, unfortunately. So
Yeah,
good
and
luck.
it's definitely education, education, education. That is going to be the key, whether it's the, you're talking about your young grandkids or in high school. It's going to be changing the narrative, and it's going to have to be finding ways around that narrative and finding different ways to educate. It's going to be a generational thing. As those generations come up, they're much more empowered about their bodies. They know so much more about their bodies than we do, and I think we support here at Desert Harvest, we support two very important programs that we believe in, which is one, which is an educational program put on by a sex therapist in New England that teaches from birth to 9 years, and how that the body during those ages, they don't think of sex as sex like we would as adults. There, it's a self-exploration of their body, and not creating shame around that when they're that age is so critical to their future sexual health, and having a healthy relationship with their bodies. And then same thing, we support another program where they can't get the correct sex education that they need to in schools. And so a girl in high school in Brooklyn, named Tara, she actually got with sex educators around the United States, created an entire curriculum. And now kids can take her course and become sex educators for their schools. So almost like the next Netflix TV show, Sex Education.
Mhm.
She took that as her inspiration, and literally now, with their parents' permission, these teenagers are taking the courses, and they're becoming the sex educators for their schools. When you can't do it yourself, find a way around.
And
Mhm.
let's be clear, you're talking about female genitalia, not male.
Mm-hmm.
You
Yep.
and just I'll just go through this really quickly because I think it really defines our problem here, is that when little boys are 2, 2.5, we teach them to reach into their pants, pull out their penis, hold on to it, and point it at the toilet. Okay, hold on, make sure it's going in the right place. Don't let it go out of the toilet. They do that umpteen times a day until they're potty trained. And there's nothing normal. This is totally normal until they're potty trained. And then they get to pull it out when they really have to go to the bathroom and they really have a full bladder. Everybody knows what that's like. And you sit down to go to the bathroom. And so they pull it out and they go, ah. So from an early age, boys associate pleasure with their penises. It's just the way it is.
Mhm.
Girls, yeah, not so much. They end up more with what you talked about. They end up with more shame. They end up with guilt. And that stays with them for their entire lives. And that's one of the things when I teach, one of the big things I talk about is we have to get women past that guilt, that shame, that anxiety that was brought onto them at a very early age. Because as Heather says, as you say, it's sexual exploration. If we would leave the kids alone, they're not going to be messing with each other. Well, they might be messing with each other because boys are different than girls and they want to see what's different. And that should be okay. And most of the times it's just not, unfortunately.
Yeah.
Definitely
Mhm.
generational because, I mean, my generation, people didn't talk at all about masturbation. Men or boys, absolutely, no problem.
No issues, no guilt, no shame.
Popular, the more you did it, the more popular you were. And girls, the opposite. I wouldn't do that. What are you talking? No, I don't. I've never done that before. It was like shameful. Um, you can't openly talk about masturbation, and I'm not sure about, and you would guys obviously would know more than I would in terms of do your patients or your past patients were they open to talking about masturbation and feeling
Mhm.
comfortable?
That's such an interesting question because again, as I look back on my years of practice, I started talking about sex in the public at a meeting, a physical therapist in 1996 or 97. So I've been talking about sex forever. I talked about sex to all of my patients. When I would go through their history, I said, "Do you ever have an orgasm?" Oh, no, no. And then as we go on and on and on, and I talk about self-practice, well, do you ever self-stimulate? Do you ever self-pleasure? Oh gosh, yeah, I do that twice a week. It's like, okay, that's an orgasm, but they totally disconnect from what they
Hmm.
do as their own self-pleasuring to having self-pleasuring during intercourse. It was one of the hardest things that I had, was that to try to get my patients with vulvar pain, as they're going through the process of healing, to use their own self-pleasuring during their sexual activity with their partners, because they say, "Oh, I can't do that. My boyfriend will think, or my husband will think they don't need me anymore." It's like,
Mhm.
so there's that. So I realized just in the very recent past that I depended way too much on the quantity of their sexual expression rather than the quality.
Mhm.
Because if I've talked more about quality and how you can have pleasure just being together and really focusing more on all of the sensual kinds of things, which I talked about, but I didn't dwell on it, I think I would have had a lot more success. We're really good at getting rid of pain in women who have vulvar pain, but
Mhm.
then we just say, okay, go on and do your thing. Well, I don't think women really know what they're supposed to do. So it becomes incumbent on us in our worlds to help women understand that this anatomy matters. This is your anatomy, and you need to take time away from your partner and figure out how you can make this fabulous little piece of equipment in our bodies work well. That's my rant.
Mhm.
Another
And then we can go alert, alert. Let's talk about the 12 different types of orgasms that
perfect,
a woman can have.
perfect,
Yes. Tell us
perfect.
more about those.
Yeah, so Dee, I'll let you kind of talk about how you can engage with these from a pain perspective, and I'll really kind of just talk about them just in general. So the first one is the one, and in our industry, we kind of start to not really utilize this, but the G spot, the Grafenberg spot. That is going to be your typical, and this is an elusive spot because it's a little bit different for everybody anatomy wise. And it's really your vaginal orgasm. It is really stimulating. And in that spot, some people can have it just in the anterior of their wall. Some people can have it higher up in the abdomen area. And this is why sometimes, and I'll let Dee kind of describe, she's got the anatomy there. I don't have the structures with me. So, but this is why sometimes like doggy style can really stimulate the G spot, because when you're in that angle and if you put pillows underneath your abdomen, you can really kind of engage that spot as well as your opening at the same time, and you're having a multifaceted orgasm. D,
Well,
you want to show?
interestingly, the medical literature doesn't think that the G spot exists. Now,
Yes.
my dear friends are both sexological body workers, and they swear that it does, and it whatever. So I don't try to go there, yes or no, one way or the other.
Yeah.
But I would like to just remind you that this little area right here is the
Mm.
bottom, is at the top of the vestibular bulbs. And it's my sense that that spot just inside the opening of the vagina and on the other side of the urethra, which is where G spot typically sits, or where they say it sits, it's my sense is they're stimulating that top part of the vestibular bone. We don't have research on that. And well, we
Mhm.
don't have research really much on the G spot either, but yeah. So
No. And
also
it would,
orgasm. So I don't know if that's, you're going to talk about that too. So,
which one? Oh, the A, like, yeah, there is
oh,
definitely, I didn't kind of do these. You can definitely talk about this. So when you talk about the A spot, that's really a true spot. That's going to be on that interior, the front wall. And just realize that this one's closer to the cervix and the belly button, the A spot, and it's a little bit higher up there, kind of. And so the A spot can really is in that similar area. And again, what Dee just showed, it's part of that whole clitoral network. And it's that interior clitoral network you're stimulating when you're stimulating that anterior, that front wall of your vagina, you're stimulating that area. And so really the G spot and the A spot are kind of in both on that anterior wall. The G spot, like Dee said, is very elusive and not medically documented, whereas the A spot is, and both of those are going to be on that anterior wall of your vaginal wall. And then number two, you can also have well, number three, I guess, because we went to the A spot, is you can also have a nipple orgasm. This is part of your network of stimulation, and this is stimulating via what you call the vagus nerve. And just to give you an idea, the vagus nerve is running from here all the way to your pelvis. And so it is literally connecting everything in your body. So when you're stimulating your nipples, you're stimulating and your network of nerves. But the network of nerves specifically in the nipples are a super highway down to your pelvic floor. And same thing with an oral orgasm. People can actually orgasm orally. This is probably a horrible example, but back in the 70s, there was what was her name? Debbie Does Dallas or something in the porn world. And she literally had orgasmic potential by giving others oral sex because she had a tissue, a nerve bundle in the back inside her mouth that simulated an orgasm for her. But again, she was stimulating that superhighway. She was stimulating that neural pathway, that network of neural tissues. The other, and I mentioned this before, remember your anal biome, you can have an anal orgasm as well. And this is going to be slightly in a different spot for everybody. And this is where if you do decide to access your anal orgasm, you can try different dilator type tools that are going to slightly bend, but can also be very, very thin for you to test out and try out. There are also anal stimulators, other things like that. But if you want to get and just try it out lightly, you could even use a vaginal dilator at its smallest size and try to stimulate that anal network of tissue as well, which is also that interior part of your pelvic floor that you're stimulating there, and a whole nother part of your network of neural tissues as well. And then jump in here, Dee, at any point if you want to add to my comments.
Yeah.
Especially when we're talking about different, and these are ways in which you can engage in different ways of having orgasmic potential, especially if vaginal penetration is an unavailable option. And that's really what these are all about. These can also be multifaceted. So don't think about just one in a sense. You could stimulate all of these areas at once. You've got a urethral orgasm, that urethra on Dee's model there. You can stimulate your urethra, which is going to be right in between your vaginal opening and your clitoral nub right there. So you can access that as well. Cervical orgasms, you can actually stimulate, and so for some people this can be more painful, especially when we're talking about pelvic floor dysfunction, things like that. You can, but it is possible by tapping the opening to the cervix that you can actually have a cervical orgasm, which is a completely different orgasm. And then, of course, just as I mentioned before, that blended orgasm, experiencing multiple areas at once. And then you can even have mental, if you daydream, or, we more equate this to men, but women can have this as well. Wet dreams, daydreaming. The mind is a powerful tool. And remember how I talked about that vagus nerve connecting from, the top to bottom here. You can stimulate this area to cause an orgasm as well. And then lastly, exercise-induced orgasms, which is a lot of cases stimulating that cervical network of tissue as well. When you're having exercise-induced type orgasms, you're usually stimulating, if you've ever, in some cases, you can actually be directly stimulating the cervical nub, riding a bicycle, things like that. Yeah, and there are different ways in which you can have an exercise-induced orgasm, because as you're moving, especially even in yoga, this is another great example. When you always have a part of your body that's relaxed and a part of your body that's engaged. So as you're relaxing and you're heightening up here, you can induce an orgasm in a sense, by relaxing and engaging at the same time. So that's another good example. And so that kind of goes over the multiple 12 different types of orgasms that a woman can have. And it all just depends on what works for you. And this is about self-exploration, exploring your body, like Dee had said. Get to know your own body. If you haven't gotten in touch with your labia minora, your labia majora, minora and majora, both, experiment, touch, feel how the inside of your thighs feel how you feel with your nipples. This is a self-exploration you can do all by yourself, and you can explore your entire body and set the mood, create the right environment, music, candles, scent, engage all the senses, so that then you can sit there for 20 minutes and engage with your body, feel your body, explore your body. You don't even have to get to clitoral stimulation. You can save that for last, the end, the creme de la creme, and really just learn how to engage with your body.
So what do you recommend for those struggling with, a hypertonic pelvic floor, those who have vaginismus, vulvodynia, pelvic floor dysfunction, IC, because a lot of them are worried about exploration. So what would you recommend for that population?
Well, and I'll let Dee go a little bit more into it, but definitely that exploring your body in the different ways and accessing the pleasure, which Dee, the expert about here, can tell you how to really access your pleasure.
And again, all of anybody who has a chronic condition, something that's lasted more than 3 months, has trauma. So we really have to deal with all of those issues on top of our sexuality and sensuality. So it's really important. We have to learn how to have pleasure throughout our lives and throughout our bodies. Heather talked just a little bit about it. It's touch, it's sight, it's smell, it's sound, it's hearing. We need to build all of this in our lives throughout the course of every day. Okay? The more we go out, or let's go this way. The more we go out the door like this, the more we sit in our cars, the more we go from garage to car park to office, we're missing out on so many things that can cause that pleasure. It's free, it never expires, but you just have to take advantage of it. You have to walk outside and say, God, what a gorgeous sky. Feel that sunshine. Listen to your favorite song. Take that hot bath with candles burning and your favorite music playing. Because all of that along the way increases the positive feel-good endorphins. Elizabeth and I talk about in our book how you always want to keep your pleasure bucket as full as you possibly can. Because once you have those endorphins already elevated, when we go to do anything sexually, we're already on that ladder going up into where we need to be fully sexually, sensually satisfied. But it has to start outside of intercourse. It has to start outside of possibly even clitoral stimulation. It can start with, as Heather talked about, with the breast, with the nipples, finding out what feels good. There are a number of different kinds of programs out there that teach you how to find the touch that you like and the touch that your partner likes. They may be totally, completely different. Surprise, surprise. They may be totally, completely different if you have same-sex couples. They may be totally, completely different. But if you're using the touch that you like on your partner and your partner's using the touch that they like on you, you're missing the boat. So communication, communication, communication. Certainly dealing with all of the issues, dealing with the IC, dealing with the endometriosis, dealing with the vaginismus, chronic vulvar pain are all very important. But I'm here to tell you that all of those things are having an impact on what's happening. Oh, what's happening in the pelvic floor muscles. I'm a very firm believer that when we're dealing with chronic vulvar pain, we don't just treat the pelvic floor muscles. Because I think the pelvic floor muscles are nothing but a symptom of something else going on, of low back pain, of hip pain, of endometriosis, of interstitial cystitis, of chronic bowel dysfunction. If we don't get in and treat those other problems first, our poor pelvic floor is going to be held hostage. And we need it because these are the muscles that contract and relax with orgasm. And if they're not mobile, if they're not functioning, it's going to make everything impossible, difficult to impossible. Not totally impossible, but difficult to impossible. So it's important that that anatomy be addressed and those dysfunctions be addressed wherever it will be. I'm obviously biased. I'm a pelvic floor physical therapist and dealt with these problems for years and years. And they can be dealt with without drugs, maybe with drugs help along the way. But as physical therapists who are trained in this technique, we can do a lot to make everything just a little bit calmer, a little bit better, decreasing that stress, anxiety, and trauma along the way, and really getting back into some really basic good function.
Mhm. There's a strong mental component, I think, that
100%.
clearly needs to be addressed as well.
100%.
So hopefully people recognize that and take that approach. Heather, did you want to add anything?
Well, I think this leads perfectly into how I was going to kind of end this for everybody, if you'd like.
Yeah.
So one of the things that I am right now actually finishing my PhD in Tantra. And so Tantra is really about, and a lot about what Dee is describing here. It's about discovering your body, exploring your body, but also engaging with your pleasure. And to engage with your pleasure, you need to go internal, not just externally, not just functionary, not just and so much of that. And that's why I was thinking like walking through a meditation. And I'll do a very simple one. This is more of a breathing exercise slash meditation. And this is really about calming the parasympathetic nervous system, just kind of so that then you can go inward and really truly engage with your body. This is something that you can simply do before you start your self-discovery. This is something that you can start, and you can take this so much further. There's so much more that can be done within Tantra to be able to engage with your body, to engorge blood flow into your vulvar region and into your vaginal wall as well. And so really for me, if you're game, I'll go ahead and kind of, okay. So
Yes,
everybody.
let's do it.
So first to begin, find a comfortable seated position, sitting with your spine straight, head with your chin tilted slightly downward, tongue on the roof of your mouth. You can either do your eyes in a soft gaze or closed, and hands in a comfortable position. And then first begin by following your breath as you inhale and exhale through the nose. Start to settle into your breath. And then this, you might want to, if you have your eyes closed, just to kind of show you, I want you to take these two fingers and bring them in to your hand like this. And then utilize your ring finger and your thumb. You don't have to press all the way down, but put them on the either side of your nose. So this will be your thumb and your ring finger. So thumb and ring finger on either side, and then those two fingers folded in. Okay. And then use your ring finger to block your left nostril. And breathe in through the right nostril, taking a nice long breath. Then block both nostrils and pause for just a second at the top of your breath. And then release the left nostril and breathe out through the left nostril. Then breathe in through the left nostril, taking a nice long breath. Then pause at the top of the breath, blocking both nostrils. Then release the right nostril and breathe out through the right nostril. Then breathe in through the right nostril, taking a nice long breath. Then pause at the top of the breath, blocking both nostrils. Then release the right nostril and breathe out through the right nostril. Then release the left nostril and then breathe out through the left nostril. Then breathe in through the left nostril, taking a nice long breath. And then pause at the top, blocking both nostrils. Then release the right nostril and breathe out through the right nostril. And then you can just do this over and over again, switching sides until you feel that you are in a very calm state. And then you can lower your hands down to your knees. Let your head float back up to a more comfortable position. And then slowly open your eyes and give yourself time to adjust back to the world around you. And this is just a simple breath that you can just take anywhere. This is it's a blend of Hindu and Buddhist traditions. It's a way to stimulate the parasympathetic response in your body, bring it to a relaxed state, and it brings you inwards. And it also, at the same time, by switching sides back and forth, you're balancing your right and your left brain so you feel more centered and calmed.
Lovely. Thank you.
Loved it. Thank you so much. I've never done one like that, and it was actually quite special. I love breathing. I just
But kind of important.
yeah, but taking big, deep, like I just find breathing so calming.
Calming.
So that one was great because I've never done it where I've blocked a nostril and done it. I've just kind of done it with both nostrils open and inhaling and exhaling. So that was really special. I like that. I'm going to do that
And
from now
just
on.
remember, yeah, just really quick that when we breathe in, it's sympathetic. And when we breathe out, it's parasympathetic. So that when you're hyped up, you're nervous, you're scared, whatever, what do you typically do?
Mm-hmm.
Heart rate, your blood pressure, everything just elevates. But if you come in and then you let a long withdrawal,
Mm-hmm.
parasympathetic, and it really is very calming. Just remember that with anxiety, with fear, with tension, just to take a short breath in, hold it, as Heather said, and really let a long exhale come out. Keys into parasympathetics and really brings you down. So,
yeah.
Thank you,
It's
Heather.
thinking of your pelvic floor like this, like that hypertonic pelvic floor, being in that chronic pain state, your pelvic floor becomes like this. So really, it's also relaxing that pelvic floor for you, helping to relax. And you can definitely take this as many steps further. I do it for about 20 minutes a day. And so it's really, and it's about running what we call the elements, what you would say the chakras. In Buddhist tradition, it's the elements. And it's really about running up and down that vagus nerve. And so really feeling like you're moving energy up and down through that central channel. And then you're engaging all the facets of your body along that vagus nerve. And so, and really directing your center. And there are many meditations that can really direct things down into your pelvic floor region, which is and is really going to help release that tension to engage in sexual pleasure and not end in pain always. So
If I may, and I know we're way over time here, just add one little brief thing, because I think breath
Of course.
is key to everything, in particular hypertonic overactive pelvic floor. Because what oftentimes happens when people have pelvic floor issues, their breathing is here. Because when you do a really good deep breath and really let your diaphragm come down and your rib cage get bigger, you're mobilizing, putting pressure all the way down through your gut into your pelvic floor. And as you take that breath in, the pelvic floor reflexively relaxes. And that motion helps to stretch it just a little bit. So as you're doing these exercises, which are really wonderful, or even your deep breathing, sure you can put your rib cage and make sure when you breathe in, your chest doesn't move, go out. Rib cage does, because that's a much more productive breath.
Well, thank you so much. This has been a really incredible conversation. I've really enjoyed it. I think our viewers are really going to enjoy it. We need to talk about this much more. Let's hope the conversation continues. And this is just a gateway to people, especially women, wanting to explore their sexuality and get comfortable talking about it and taking part in being sexual. So thank you. A huge thank you to Desert Harvest for sponsoring today. And hopefully we will have another conversation again soon. You ladies are amazing. Thank you.
thank you.
Wonderful. Thank you so much. Thank you.
Thank you, ladies. Bye.